What is arginine? Arginine is an amino acid considered conditionally essential. The human body is able to synthesize it from citrulline, but in many occasions this synthesis is not enough to cover the demands, especially in athletes, stress, or infection. In turn, citrulline can be formed from glutamate, proline, glutamine, and ornithine. Arginine participates in protein synthesis, is able to serve as a source of energy, plays an important role in wound healing, participates in collagen synthesis, and improves the function of immune system cells. One of the most important functions of arginine is the detoxification of ammonia produced by the catabolism of other amino acids through the urea cycle. Briefly, the urea cycle can be summarized as follows. An ornithine molecule combines with an ammonia molecule, NH3, and a CO2 molecule to form citrulline. This citrulline captures a second ammonia molecule to form arginine. This is hydrolyzed to finally form urea and ornithine. The formed ornithine continues the cycle again. The metabolism of arginine is capable of forming a multitude of compounds such as nitric oxide, creatine, glutamate, polyamines, amino acids. Nitric oxide, NO, is a substance that acts as a vasodilator, antiplatelet agent, reduces vascular resistance, relaxes the endothelium, limits the appearance of atherosclerosis, and favors the immune response. Nitric oxide is formed from arginine by the enzyme nitric oxide synthase. NO production increases the supply of blood and nutrients to the muscle and is enhanced by the contractile activity of the muscle. Nitric oxide also regulates muscle functions such as force production, muscle blood flow, muscle cell differentiation, cellular respiration, and balance of glucose metabolism. Arginine is also a precursor of creatine, along with glycine and methionine. Creatine is an energy reserve compound and its supply is necessary to maintain creatine deposits in the body. Other points to highlight about arginine is its ability to stimulate the synthesis of hormones such as growth hormone, GH, insulin, or glucagon. It is believed that these effects are mediated by the suppression of endogenous somatostatin secretion, favoring muscle mass gain and fat loss. Citrulline, arginine, and ornithine reduce ammonia and lactate levels in the blood produced during exercise, increasing tolerance to intense exercise. These amino acids also accelerate recovery by promoting muscle synthesis of glycogen and glutamine. Arginine activates the mTOR, mammalian target protein kinase of rapamycin, signaling pathway in the intestinal cells which stimulates protein synthesis and intestinal tissue repair as long as excessive amounts are not used. Some natural sources of arginine are animal origin. Dairy products, meat products, red meat, chicken, fish, and seafood. Vegetable origin, onion, garlic, asparagus, lettuce, nuts, chocolate, and brewer's yeast. There are different ways of administering arginine. Arginine hydrochloride is the first form in which it began to be supplied, but about 20% of its weight does not correspond to the amino acid. A more modern form of consuming arginine is L-arginine, in which 100% is arginine, although it can generate some gastrointestinal discomfort, especially if consumed on an empty stomach. Finally, the most sophisticated and better absorbed form is in the form of peptides such as arginine alpha-ketoglutarate or ornithine alpha-ketoglutarate, precursor. What is arginine for? The contribution of arginine is intended to guarantee the intake of this amino acid and to ensure that its functions develop correctly. Sport and physical activity. As an ergogenic aid, the consumption of arginine seeks to stimulate the synthesis of nitric oxide in order to provide greater blood flow to the muscle and, consequently, a greater supply of nutrients and oxygen. In addition, it also reduces lactic acid concentration, fatigue, and improves recovery and muscular endurance. Recent studies seem to indicate that the combined supplementation of L-arginine and L-aspartate increases fat utilization and reduces blood lactate levels during exercise. It also decreases heart rate and ventilation in non-submaximal efforts. These effects imply an increase in work capacity and exercise tolerance. All these characteristics are useful in different sports disciplines, whether strength or endurance. In addition, the consumption of arginine also seeks to stimulate the synthesis of anabolic hormones and thus achieve greater muscle development in fitness athletes. Other therapeutic applications. Arginine, for its ability to increase nitric oxide synthesis, is used to increase exercise tolerance in people with heart disease and to modulate the function of blood vessels. Because of its vasodilator capacity, it is also used in cases of organic erectile dysfunction, and recent studies have found increases in testosterone production when given together with polyphenol, pycnogenol. In clinical nutrition, it has an important role used in patients with metabolic stress or infections in combination with other nutrients. Arginine dosage. The intake of arginine as a dietary supplement is around 3.5 to 5 grams per day, and it is usually recommended to take it spread throughout the day and on an empty stomach. Supplementation in athletes recovering from an injury is 2 to 3 grams 3 times a day, and some studies mark the optimal dose as an ergogenic aid at 9 grams a day. For therapeutic doses or in cases of cardiac ailments, a medical practitioner should be the one to indicate the most appropriate dose. Precautions with arginine. Arginine has no side effects at doses of less than 20 g per day, but should be avoided when used in large doses for prolonged periods of time. Its use is not recommended in people suffering from herpes and should be taken with caution in people with asthma, diabetics, people under treatment with anticoagulants, and liver disease. It is also not recommended for pregnant women, women at risk of hemorrhage, or women taking contraceptives. Arginine can reduce blood pressure, so people with orthostatic hypotension should be cautious with its consumption, as well as if they are taking medication against hypertension.